now it's my very great pleasure to introduce to you one of my favorite education specialists and naturopathic physicians. That would be Dr. Holly Lucille. She is nationally recognized. She is an integrative medicine expert. Not only is she an educator, but she also consults with a variety of companies on natural products and product development, and she is a patient advocate. She is the author of several books, including Creating and Maintaining Balance, A Woman's Guide to Safe Natural Hormonal Health. Her list of media appearances are almost too numerous to mention. In addition to appearing on Dr. Oz and The Doctors and Healing Quest and Discovery Fit and Health Channel, Dr. Lucille has also hosted her own radio and television shows in a variety of channels. So it is with great pleasure that I introduce to you Dr. Holly Lucille. Welcome, Dr. Lucille.
All right, so we're gonna continue on. If there's any other problems, just please let those lovely people know, and we're gonna take care of you. So I was talking about the endocannabinoid system, and we're going to get into that. So interest, honestly, in this system and in medicines from cannabis have completely skyrocketed as more and more research has been uncovered about the endocannabinoid system. And interestingly enough, the reason that we know more and more about this system is because people were like, hey, how does marijuana work? I mean, obviously people can consume it in a variety of different ways, and there's an effect on the body. And so for the most part, the questions were like, hey, what is this system? How does it work? And, you know, some of the research has basically been neglected because of its association with marijuana. And of course, marijuana has a very heavy connotation, at least in my opinion, of it being an illicit drug, of it being negative. But what I'm going to do is highlight the importance right now. What we're going to talk about throughout the webinar is that we're talking truly about botanical medicines or plant medicines, which if you've heard me talk in the past, I'm very passionate about it because I think that plants are so incredible and they can offer so many medicinal benefits for us. And so I want to kind of take the sting out of marijuana and just understand that it is a plant, but like anything else, even your own social media, and you can use things for good or evil. And so we're going to just talk about all of that, all right, and kind of try to get through some of the connotations because I think what's so important is really for you to understand the system and understand that it really has a lot to do with how we're feeling, and if it's unbalanced, we can do things to make it better. And so this really has only been investigated since 1988. And when you think about the endocannabinoid system, you know, it's a rich and complex system of biochemical molecules and receptors that affect every system in the body. Okay, we all have it. It's kind of like the cardiovascular system or the endocrine system or the respiratory system. This is inside of us. So as I was saying, the use of medicine from cannabis is gaining acceptance. Dr. Sanjay Gupta, he's the CNN, I believe he is he's actually a brain surgeon. He is the CNN lead medical correspondent. But as he states here, we have been terribly and systematically misled for nearly 70 years in the United States. And he has started to understand the benefits of this plant medicine. And I think that that was a really powerful statement. Once again, this is just a screenshot. It's nothing that we can play. I think that was told to me earlier and I read it wrong. But as Dr. Gupta is saying, I was wrong about weed. And that's one other thing that it's so important for me to talk about something like this because, of course, marijuana does have slang names like weed and pot, and it's known as a drug. But we want to tease out the medicinal benefits of all of this and understand all of that nomenclature when it comes to marijuana, hemp, CBD, et cetera. So you guys stay tuned here because it's great information. And like I said, very, really recent. So the endocannabinoid system, we all have it. Like I said, respiratory system, yep, we got it. Cardiovascular system, yep, we got it. Endocrine system, yep, we got it. This endocannabinoid system, I like to think about it kind of like a smartphone. It's an information delivery system. Your phone receives messages from the cell tower and then passes it along, easy for me to say, to other parts of the body as needed. So the majority of this is active in the central nervous system, so that's the brain and the spinal cord and all that they control, but also it's sending messages to the peripheral nervous system. Those are all the nerves outside of the brain and the spinal cord, and also the peripheral organs, including the digestive system. Now, it really does control everything, and it involves receptors, lignins, and enzymes. Lignins are basically molecules that bind one substance to another, and enzymes are molecules that speed up chemical reactions, okay? So we've got receptors, lignins, and enzymes, and they're found in virtually every part of the human body. A little bit just, to get started about receptors. Receptors are like a little switch on the cell. And so when they're turned on, it causes the cell to act in a specific way. For example, let's say an endocannabinoid receptor may be involved in inflammation. So when an endocannabinoid lignin attaches itself to that little seat, that receptor, an anti-inflammatory response occurs. There are also endocannabinoid receptors associated with like nausea. And so when these receptors are turned on by lignins, the end result would be an anti-nausea effect. And so that's just these receptor sites are, they just, when they're switched on, they can cause a cell to act in a specific way. And that's really important to understand because that is what's actually controlling. We've probably talked about hormones before. Hormones are like the keys, and then the receptor sites are like the locks. And you hit it in there, and then it turns on, and it tells the body to do something, all right? So endo means from within. We actually have our own endocannabinoids. Endogenous. The endocannabinoid system equals endogenous cannabinoid system. It means we make our own cannabinoids. So yes, we are going to talk about these plant medicines that are so powerful out there that we can actually use in a medicinal way to have a positive effect in our body. And listen, kids, I am talking about the things that I've seen in the research and the things that I've actually seen in my practice because of the research. We have an opportunity to treat dozens of disease conditions. I mean, anxiety disorders, neurological disorders, that includes Parkinson's and Huntington's and heart disease, atherosclerosis, high blood pressure, glaucoma, metabolic syndrome. I mean, the list goes on and on when we understand more and more about the system. So just basically, for your edification, we make two endocannabinoids. One is called 2-AG, and then the other one is called anandamide. So these are created in the body through our dietary fat intake. So once again, this is just everything about good fats, doing wonderful things in our body. And I love this. No anandamide, no bliss. We really need to make these endocannabinoids. And like anything else, things in our body can be imbalanced and they can start breaking down. And this can happen with our endocannabinoid system. So back to these receptors. There's CB1, that's the, and CB2 receptors, okay? These are our endocannabinoid receptors. CB1 are primarily found in the nervous system, but also in certain organs like the liver, the thyroid, the adrenals, and our reproductive organs. CB2 are receptors that are found in the periphery and organs with high immune system activity. And then CB1 and CB2 are both found in the eyes, the stomach, the heart, the pancreas, the digestive tract, and the bone. So as I said, the system is extremely important, and it can regulate almost everything in our body. So what does it do? Well, it's part of our normal physiology, and it's constantly trying to bring balance on a cellular level. And just like anything else, when the endocannabinoid system is out of balance, this is when we feel symptoms or we have disease conditions. And so I want you to start looking at the endocannabinoid system, like I said, in comparison to any other system that you well know about, that you already have, the respiratory system, the cardiovascular system, et cetera, et cetera, et cetera. This is a system of physiology that we have that's constantly maintaining balance at a cellular level, and there can be disconnects. There's actually something called endocannabinoid deficiency, and we're going to talk more about that. But when that happens, because, we have shortfalls in key nutrients, especially in omega-3s, this can become imbalanced. And that's where we're going to get into, hey, what can we then do about it? So just as a reminder, here's what you need to know. The endocannabinoid system, say that really fast, 10 times, endocannabinoid, endocannabinoid. Endocannabinoid system plays a role in regulating so much: anxiety, appetite, metabolism, energy, fatigue, memory, immune function, and truly so much more. And so if it becomes imbalanced or if there is an endocannabinoid system deficiency, we have plant medicines that can help restore the balance to the endocannabinoid system. Then we can start reversing disease conditions, and best yet, we can decrease these symptoms that folks show up with in my practice, and I know complain about each and every day. All right, so you can see all of those words in this little word salad here. Medicine, is it a plant? You've heard as THC, cannabis, anxiety, pot, headaches, depression, CBD, hemp, sleep, fatigue, cramps, marijuana. It can get really confusing. And here's what we're going to try to do is sort out cannabis, marijuana, hemp, THC, CBD. What are they, and how can we learn to use this particular plant and plant compounds to help the body balance, and also just to help, honestly, control symptoms of chronic fatigue and fibromyalgia, seizure disorders. Migraine headaches even have been in the research, IBS, any digestive complaint, so much more. So cannabis can be used to refer to either hemp or marijuana, okay? And that's where we want to get clear on some of these words and what they mean. The primary difference comes from their level of cannabidiol. That is what CBD stands for. And then THC. That's tetrahydrocannabinol, sorry. Now, it's important to note, and I think that this is one of the most important points of this webinar, is that CBD is not psychoactive. And I think that I have come across this so many times in just talking to patients and actually even talking to colleagues that people get confused when we say cannabis or hemp or marijuana because they automatically go to what they understand and they've known in the past, which is that it's pot, it's a drug, and it's going to make me high, all right? So the THC is the compound. It's the cannabinol, the tetrahydrocannabinol that is psychoactive. It's strongly psychoactive. Medicinal compounds from these plants are called cannabinoids, okay? Cannabinoids are unique to this plant, cannabis. The word, and you've heard us talk about curcumin, for example, right? Or turmeric, I should say. What is the medicinal compound of turmeric? Well, that's the curcuminoids. And once again, an incredible plant medicine. These curcuminoids, I can't say enough about this particular plant, curcumin and turmeric, but research, we can replay that webinar as well. But I just want to make that correlation because it's that same thing. When we're talking about cannabis and a powerful plant, we've got different compounds. So the word cannabinoid refers to the molecules, plant-based or human-based, that can interact with these cannabinoid receptors that I was talking about, okay, that sit on each of these cells, and if they're turned on, they can deliver a message. That's the biggest thing, all right? So here we go, differentiating between cannabinoid sources. As you remember, I said we have our own endocannabinoids. That's inside. The opposite of that is exogenous. That's outside the body, okay? And then there's plant-based cannabinoids, which are called phytocannabinoids. You've probably heard of phytoestrogens. That's another plant estrogen, like soy-derived products, okay? So then you're thinking about THC, which we just went over, the CBD, and you know what? There are a lot of others. That's the big thing. There are so many other cannabinoids that can make a difference, and that's what's making this research so exciting. And also it's kind of making it confusing for some folks, but that's what we're here just to break this down a little bit. And once again, I have introduced the two endocannabinoids that we make, as long as we've got the right building blocks. All right, so let's get into hemp versus marijuana. Hemp and marijuana both come from the Cannabis sativa plant family. Over time, hemp and marijuana were cultivated for different purposes and developed into separate strains. You know that whole thing, kingdom, phylum, family, genus, species. That's really important to understand because there's different strains, just like there's different strains of probiotics. There's different strains of lactobacillus. There's different strains of bifidobacteria, and actually they've been researched to do different things. Well, these are different strains of the cannabis sativa plant. So marijuana is cultivated to contain higher levels of that psychoactive component, THC. And the industrial hemp is cultivated to have low levels of THC and a higher CBD. That's the cannabidiol, and other cannabinoids. And it has a more fibrous stalk, because as you well know, hemp can be used to make clothing. It can be used to make so much. I'm going to go over that here in a bit. So industrial hemp was grown for stalk and seeds and fibers, and you see that picture there. You can see how sturdy it is. And then marijuana was cultivated for the flowers and the leaves because of the higher concentration of THC. And that's also another important point when you're talking about plant medicine in general. There's different parts of the plant that can be used for different things. And here, I think, is a perfect example of that. So just like any other system in the body, our endocannabinoid system can be out of balance. This is when we experience not only disease conditions, but we experience symptoms. And there, like I said, there's actually a condition, believe it or not, called endocannabinoid system deficiency. And now how can we get there? Well, it directly involves our endocannabinoid system, these imbalances, if we don't make our own endocannabinoids, or if there's problems with the cannabinoid receptors or enzymes. And this, can happen because of poor diet, because of stress, because of environmental toxins, just like anything else in our body that's under attack from not being nourished enough, from having too much oxidative stress because of our multiple stressors in our modern day world. The environment plays a huge role. So getting familiar with this endocannabinoid system is not going to be that hard because it's really impacted like anything else that's precious in our body. So if you have an imbalanced endocannabinoid system, you have an increased risk for disease, for epilepsy, for anxiety, for breast cancer, for osteoarthritis, for prostate cancer. Your endocannabinoid system affects your physical and your mental well-being, and adapting to health conditions and environmental situations as needed. So hemp oil, which we're going to talk more about with a full spectrum of the phytocannabinoids, once again, that's those cannabinoids, yes, we make our own, but these are from the plants, can provide nutrients for the system and can help fill the gaps due to any deficiencies that we have on our own. And so if you look at all of these conditions, this is what's so exciting to me as a practitioner. If your endocannabinoid system is out of balance due to anything that we might see in our modern day, and you have multiple sclerosis or osteoarthritis, when we think about skin conditions, we can actually use plant medicine to treat people that present with any of these things: migraine headaches, digestive disorders, diabetes, rheumatoid arthritis, any other autoimmune diseases. And I think that's what's so exciting about learning more and more and more about how the system responds and acts, not only to our own internal environment, but also to those exogenous phytocannabinoids. I mean, it's absolutely fascinating to me. And we can supplement this with those phytocannabinoids, like I said, from cannabis. And like I said, we had gone over the cannabidiol, the CBD that we're hearing more and more about, the THC that we know about because of its connotation with the drug and the psychoactiveness, but there's CBCs and CBGs and CBNs, and why CBD and THC receive really much of the attention. There are over 100 cannabinoids found in cannabis. Very important to understand that. So don't worry, we're not going to go into this. The modulation of the endocannabinoid system by phytocannabinoids is extremely complex, but I think this graphic shows that this is in our bodies, and they've got these receptor sites and these enzymes and these lignins that are helping the endocannabinoid system respond to these phytocannabinoids, and that's how we're getting the end result of symptom relief and a decrease in disease state, and also better outcomes when it comes to a healthy population. If you see down at the bottom there, we've got our own anandamide and also the 2-AG that are affecting the endocannabinoid system as well. So I want to keep this as simple as possible, because I think that if we just break it down a little bit and once again tease out the connotations and just understand what the system is and how it's responding to plant medicines, that's the sweet spot of this webinar. So this slide is actually scaring me a little bit, so I'm going to get on with it. So just a brief history. You know, my parents were both pharmacists, and my mom passed away a couple years ago, but when she did, I had kind of earmarked, she has all of this old medicinal bottles, and they look exactly like all of that stuff, and so I was able to grab one of them, but these are our old pharmacy bottles. Cannabis has been part of a human history for thousands of years. It's used ceremonially, medicinally for sure, agriculturally. It's been found in tombs dating 25 years old, and so it's been around for a long time, and it was listed in the U.S. Pharmacopoeia for almost 100 years, from 1850 to 1942. It was routinely used up until the 1940s for a variety of health conditions, mostly for sleep, for pain, for migraines, and for menstrual cramps. So the uses of hemp, as I mentioned, because if you remember how that picture of the hemp crop and how sturdy those stalks are, I mean, for fuel, for animal bedding, for construction, paper products, animal food, body care products. Hemp is an incredible agricultural crop, and it can be used for so many different things. Just a little brief history of both of these things. So our plant cannabinoids, we've got the seeds, and they don't have any cannabinoids in them. They are full of omega fatty acids. Of course, those are healthy fats, but from Cannabis sativa, we've got the leaf and the flower, which is the marijuana, where we've got higher amounts of THC, psychoactive, lower amounts of the CBD, but the phytocannabinoids in the industrial hemp stalk, that's where we've got that higher level of CBD, okay? Hemp contains, as I'm going to just reiterate, almost 80 to 100 phytocannabinoids. In addition to THC and cannabidiol, the CBD, it's got the CBN, the CBC, the CBDV. I'm not going to subject you to me potentially butchering all of these different cannabinoids, but I think it's important to understand that each of these cannabinoids really has its own unique activity. And that's why we can use it for so many different things. So using hemp oil is becoming extremely popular to help balance out any endocannabinoid system deficiency or imbalance. It can be extracted and processed into oil, okay? And this, we're talking about that wonderful crop hemp. A variety of processing methods can be used. CO2 extraction is preferred, and this is, of course, what we're trying to do when we're harvesting and processing this into a medicine, is to preserve the constituents that have medicinal benefits. Now, when you look at any plant, and there's different schools of thought on this, but a full spectrum hemp oil really includes a broader array of the cannabinoids. As I said, there's 80 to 100, right? So when you're looking at full spectrum, you're getting a sample of the many cannabinoids that are available through hemp. And it's been shown that full-spectrum hemp oil extracts are actually superior. They've got the CBN, the CBG, the CBC, the CBD. CBN has been touted for promoting restful sleep, for bone density, and helping to stop convulsions. CBG relieves pain, is antifungal and antibacterial, and it's also been shown to help fight cancer. CBC has an anti-inflammatory effect. It also has been shown to be biocidal in that it's antifungal, antibacterial, and helps fight cancer. And then the CBD that we're hearing a lot about too relieves pain, reduces the incidence of seizures, again is antibacterial, It can normalize blood sugar, helps fight nauseousness and tumors. It can calm stress and anxiety, and it also relieves skin conditions. So these are just a few of the known phytocannabinoids and just some of their functions. And also, you know, I think it's really important to understand that synergistically, when these are together, the effects of all of them is greater than the single magic bullet approach. And so when you have a full spectrum hemp oil and you're taking it, it's that synergistic compounded effect that I think is really important. And researchers are just beginning to explore how these interact together. This is very, very new stuff, and I'm so happy to be learning more about it, using it in my practice with such great outcomes. It's just really, I think the research environment is very robust, and everybody is very excited about it. But once again, we just need, like Sanjay Gupta, to understand that this isn't a, well, we could call it a drug, a medicinal drug, but it's not being used right now to get anybody high. It's actually being used to increase quality of life, decrease disease states, relieve symptoms, and I think, and you all know that I think when people feel better, they ultimately end up being better and doing better, and we can all use that right now. So I want to talk a little bit about CBD. The hemp stalk has abundant CBD. Once again, reminding you that it's the most researched cannabinoid after THC, but it's not psychoactive. It doesn't have that effect on the body. But it does have the ability to influence multiple receptors that we talked about throughout the body. It inhibits the enzymes that break down the body's own naturally produced cannabinoids, including the two that I introduced you to. That's really important, that we've got something on board, CBD, that can inhibit enzymes that are actually working against us. It also is very anti-inflammatory and has a very potent antioxidant effect. CBD, this is just a little bit of research highlights that I want to go over. Increase weight bearing and reduce joint pain. Now, this was an animal model of osteoarthritis. It was shown to reduce pancreatic inflammation. Once again, another animal study associated with type 1 diabetes. There was a small study in people with epilepsy. Basically, 50% of those participants taking the CBD were almost seizure-free, and 40% had improved versus almost no patients improving in the placebo group. Okay, so improvement of 40%, 50% almost seizure-free. And this is while receiving standard drug treatments, okay? That was the placebo group. So I noted the CBD and its effect on the receptor site being able to be anti-seizure, and you see it right there. In cells from patients with inflammatory bowel disease, CBD actually prevented inflammatory reactions, and this was a cell culture study, and those are always very, very fascinating. So anti-inflammatory properties sort of at work there. In another animal model of intestinal inflammation, CBD was able to normalize transit time versus a 23% increase in transit time in untreated animals. And so that is just one of the pieces of research with CBD when we're talking about digestive disturbances. So there are currently, right now, like I said, it's a very robust research environment, 400 clinical trials, including CBD, involving, I should say, CBD, registered at the clinicaltrials.gov. And we're talking about anything from fibromyalgia, as I mentioned, to lung disease, inflammatory bowel diseases like IBS and Crohn's disease and IBD, alcohol and drug dependency, fatty liver disease, bipolar depression, tremors, memory issues, cognitive decline, Parkinson's disease. And remember, the endocannabinoid system was discovered less than 30 years ago, and so now research is absolutely exploding. It's quite fascinating. So I want to go over another phytocannabinoid called CBC. It has been shown to ameliorate colonic inflammation of our colon. So this is another animal model of colitis and decrease small intestine hypermotility. In a cellular study, CBC, this is not a complete blood count, which is what you're used to when you get your blood drawn yearly, hopefully, and just to check that out. This is the phytocannabinoid CBC, and it was shown to increase the survival and differentiation of neural stem progenitor cells, so both human and animal. So that's huge when we're talking about cognitive issues. And also additional research with this particular phytocannabinoid, pain relief, anti-inflammatory, anti-cancer, and this is what blows me away. I understand, like, with components of plants that are antioxidant in nature, and then also, you know, anti-inflammatory, anti-cancer. We've seen that before, and I'm so impressed with this particular plant. However, when we think about bone, and bone being such an incredible process, bone metabolism, I mean, there's construction crews and demolition crews working side by side your entire life, and the osteoblasts and the osteoclasts. It's pretty profound. But to facilitate bone growth and to help treat and prevent osteopenia and osteoporosis, absolutely 100% fascinating to me. CBG, another phytocannabinoid. So I'm talking about this broad spectrum, right, that you can get in hemp oil. The parent molecules of cannabinoids, the THC, CBD, CBC, we've talked about, they start out actually as CBG. The health benefits of this one includes decreased muscle contraction and bladder dysfunction, protected neurons from inflammation and increased antioxidant levels in animals models of Huntington's disease, and then also shown to decrease colon cancer cell growth. And so just a reminder, when we're talking about this system, you know, we've got the majority of the system active in our central nervous system. So that's the brain and the spinal cord and then everything that they control. So Parkinson's, Huntington's disease, Alzheimer's, cognitive decline. It's just amazing the application of this plant to those particular disease processes. So, you know, you've got definitely these exogenous full-spectrum hemp oil that you can use to affect when your endocannabinoid system is out of balance or you have an endocannabinoid system deficiency. And we said, you know, how does it get out of balance? What causes the deficiency? Well, the same things that cause a deficiency we can actually use as well to support and help balance the endocannabinoid system. Besides the full-spectrum hemp oil, you've got the omega-3 fatty acids. We've talked about DHA, docosahexaenoic acid, EPA, and they have been shown to positively influence the endocannabinoid system, mostly by helping us continue to make our own endogenous cannabinoids, body work, so acupuncture, a good drainage lymphatic massage as well. And then always lifestyle modifications, diet, making sure, you know, I always say, you know, you look up diet in the dictionary, it means habitual nourishment. How is a habit do you nourish yourself? And if you've ever taken a biochemistry class, it's really about diet, it's really about nutrition. You know, when we talk about vitamins and nutrients and things, they're not just a couple aisles, you know, in your health food store. These are things that make your biochemistry work. They actually, all the enzymes, and, you know, enzymes, as I mentioned, are molecules that speed up chemical reactions. We have all these chemical reactions in our body to make everything work, how our liver detoxifies, how our eyes can focus, how our hands can actually pick up a cup. But all of those chemical reactions are fueled by a cofactor. Those enzymatic reactions are fueled by a cofactor, and those cofactors are vitamins and minerals. And so when we start to get deficient in them, and I see people in my practice all the time, because I'm able to test whether there's micronutrient deficiencies or poor absorption, so people might be eating but not absorbing, we can start getting imbalances in a lot of different things, including our endocannabinoid system. And so diet, weight management, exercise, and then also reducing psychoactive substances, alcohol, tobacco, coffee, all that we can tease out and have some benefit. I wouldn't say tobacco perhaps, but really increase our oxidative stress and inflammatory processes in our body. So we can always hint towards lifestyle interventions and dietary modifications as well. Now, you know, I think it's really important to just review this a little bit because as I started out, once again, I think that, and hopefully by the end of this, we're going to just have a better understanding that, look, this is a system that we all have in our body just like our cardiovascular system. And we've got receptors, we've got lignins and enzymes that are working together in virtually every part of our body sending messages, keeping things in balance. It's an active system. It's physiologically constantly making, on a cellular level, everything trying to come back into balance. And that we've got our own endocannabinoids that make a difference to the system, but we've got phytocannabinoids that also can be used to treat symptoms and disease states, and that we can get away from some of the connotations that the plant and marijuana have with how we are now using hemp and hemp oil and CBD and all the other cannabinoids. That's going to be really important to me. But what does the law say? Well, regulations around the use of industrial hemp are, I think, vague and confusing. Some states, they're not clear on the difference between them. The federal law states that hemp oil must not contain more than 0.3% of the psychoactive cannabinoid, THC. Hemp oil cannot call out CBD content due to the imminent approval of a drug form of CBD by the FDA. So there's a lot going on here, and we're going to keep an eye on it for you and continue to update for sure. But there's a lot going on with CBD and the other different phytocannabinoids. So stay tuned, but just understand that right now the federal law states that hemp oil must not contain more than 0.3% of the psychoactive cannabinoid, THC, and that the concentration, you can't call out the CBD content due to something that's on the rise there. All right, so let's just give a little bit of a recap here. Even though the modulation of the endocannabinoid system by phytocannabinoids is extremely complicated stuff, we do have this system, and that these phytocannabinoids from hemp and marijuana are both from the cannabis but are not the same, all right? Hemp contains that higher level of CBD and almost no THC. And that CBD is that phytocannabinoid that can make such a big difference in your life, in your health, in your symptoms, and in your disease state. Marijuana, that is cultivated in a different way. It's got higher levels of THC, lower levels of the medicinal part of the cannabinoids, and that's the difference. Big, 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 big difference there. And cannabinoids from hemp are useful for so many things. So many things, and they're changing people's lives. And if you've seen the documentary, and I think it actually was on CNN, and I apologize because I forget the name of it, but we're talking about young children who have seizure disorders that were able to stop seizing, and the struggles that these families are having to actually get their hands on these plant compounds, okay? As I said, as an analogy, we've got turmeric, that incredible rhizome, that horizontal root that's buried, that's, yes, it's flavorful and savory foods and such, but that medicinal component, curcumin, the curcuminoids. So here we've got this plant, right, the cannabis plant, and we've got medicinal components, these cannabinoids, and they're making a big difference. And when there is an imbalance in the body or somebody has a deficiency and or a disease state or symptoms, we can supplement. Supplement just means to add or enhance. We can supplement the body, and hemp oil, especially broad spectrum hemp oil, can definitely be used and definitely be contribute to great outcomes when it comes to all the clinical conditions that I'm seeing in my practice. So what to look for? Full spectrum, of course, non-genetically modified, tested for pesticides and herbicides, that it perhaps is CO2 extracted, so we can maintain and preserve the constituents of the plant that we want, grown and extracted outside of the U.S. to comply with current regulations, containing less than 0.3% of THC due to federal law, and should not focus on the CBD alone. Can't call out that CBD. That broad spectrum is perhaps what we're looking for. All right, so I am hoping that was a little bit of a teasing apart some miscommunication or misinformation or just old thoughts that we have. We don't know what we know, and sometimes we don't know what we do know. And when it comes to the endocannabinoid system, it's so great to know that we have one, that it too can become imbalanced, it too can become deficient, and it too then can lead to disease states, chronic fatigue, fibromyalgia, seizure disorders, cognitive things, MS, migraines, IBS, and so much more. And the use of cannabinoids can help not only treat these disease conditions, but also relieve the symptoms that cause people to have miserable lives and decrease quality of life and just feel better and be better.
Thanks so much, Dr. Lucille. What an informative presentation, and I can tell that our listeners are excited as well because we have just a very long list of questions. So why don't we get started? Are you ready?
I am ready.
All right, all right. If you were to boil it down to something very simple, because it says all body systems have organs or body tissues that are associated with its particular function, would you, if you were to boil it down to something simple, what is the function of the endocannabinoid system?
I would say the function of the endocannabinoid system is an information delivery system. It receives messages and it relays them. It passes them on to the part of the body as needed. That's as simple as I can get. It's kind of like that smartphone analogy. Receives messages from the cell tower and then passes it along to other parts of the body. But it's active everywhere.
All right, excellent. Does CBD help with seizures if there's no THC present?
Yes, absolutely.
All right. I don't know if you are familiar with this. It's not a common problem, but it's there's an autoimmune condition called granuloma annulare that's not life-threatening. Often resolves on its own, that manifests as circular lesions that appear on the skin of the hands and the feet, and sometimes the arms and legs. And this person is asking if you've ever used hemp oil with its componentry, those cannabidiols and all the other cannabinoids that are in there for this problem, or is it something that you haven't seen in your practice?
Yep, great question. And not lately. I have not seen granuloma annulare lately, but you know, sometimes I say, hey, what's in a diagnosis? I want to know the mechanism behind the diagnosis. So if you think about autoimmune conditions, and there's many of them, and get deeper into what is the root cause of any of those conditions, I would say that CBD or the phytocannabinoids in this full spectrum hemp oil would probably be a really wonderful application, and it would be indicated for sure.
Here's an excellent question. How do you know that your endocannabinoid system is out of balance as opposed to some other reason for the symptoms you're having?
Yeah, it's a great question. I mean, I think that as we're learning more and more about the endocannabinoid system, I mean, who knows? We've got all sorts of ways to understand respiratory distressors. We've got all sorts of ways to understand cardiovascular distress and imbalance, and then perhaps, you know, we'll be able to understand if we can actually test the endocannabinoid system. I think that knowledge is power, and then self-knowledge is superpower, and I think that if we learn and we understand this, and for me, what I'm doing with patients right now, and even myself, is applying this information that the system is active, it is everywhere, and it is definitely part of our body that is trying to make homeostasis and come back into balance, you know, despite our modern day living, despite our environment and all of those things, and it should be considered if there is a chronic issue that is going on, including, you know, fatigue and some of the other things. You know, it's one of those things that's changing the face of medicine, in my opinion, because, you know, as a doctor, when somebody presents, let's just say with fatigue, it's my job to do differential diagnosis, meaning, hey, what could this be? Rule out the big things, and then and rule out and then rule in. So is it an anemia? And so, you know, as we started to learn more and more about, let's say, environmental medicine and the exposure that we're having in our modern day, that changed the way that I practice. And this, then again, is changing the way that I practice because I start to understand, like, hey, this is a system that we are still understanding and that we're still learning about, but it is something that I take into consideration, and I take these powerful plant compounds into consideration then during treatment.
Excellent. This gentleman had a wonderful point, that there's a confusion between hemp oil and hemp seed oil, and both are on the market. And hemp seed is an excellent source of omega-3 fatty acids, but contains no phytocannabinoids, whereas hemp oil does not contain the omega-3 fatty acids. It contains the cannabinoids that many people are using medicinally. So they just want to make sure that we clear that up, and they're wondering if you can think of, or is there another medical term other than using the word hemp oil to avoid this confusion?
That's a great question. I mean, you're right. You know, hemp seed oil is made from crushing the seeds, and if you remember that one slide that we had, where I was like, no CBD and there are no cannabinoids whatsoever, no phytocannabinoids. It was, though, very high in omega-3s. And once again, it's the cannabis sativa plant. Oh, my gosh. And that is the hemp seed oil. Now, is there another thing that we could do? It's a great question. I don't really think I have a good answer for you, but I agree anything that we can do to clear up any confusion. So even, people that, hemp seed oil is a wonderful vegetarian source of omega-3s. And so I want people to understand that's benefit. But yes, you're right, extremely different than the hemp oil, which contains the phytocannabinoids. So it's a great question. I think I'll continue to scratch my head about that, but just make that clear. But thank you so much for bringing that up.
Yeah. There's a related question here about hemp fiber and hemp protein, both of which are on the market. Do they contain phytocannabinoids? And it's always been my understanding that it's only the stalk oil that contains significant amount of cannabinoids, not the hemp fiber or the hemp proteins. Is that what your understanding has been?
Yeah, that's exactly my understanding. And so you're right. The hemp protein is out there. Once again, a really nice vegetarian source of protein and actually fiber. But no, these products would not contain your phytocannabinoids.
Okay. Are the studies that are cited, and there are many, many more studies than we have cited today in today's webinar, are they, what kind of dosages are we looking at? I mean, are they 10 to 20 milligrams that you find in a lot of supplements, or are they hundreds of milligrams? Do you have any idea?
That's a great question, and of course I would have to go back to each and every study. But dosing is another good question, and that is and it's also involved in the robust research environment. And so there has been everything from small doses into larger doses. So I don't know the question offhand, but we can actually probably pull together some of the studies, at least the links, and get them out to the list that were list of folks who joined the webinar.
Yeah, and I think that a good point is that the dosages have been all over the board, and the good thing is that many individuals adjust dosing until they feel comfortable that their symptoms are being ameliorated. And even with very high dosing, they haven't noticed very significant adverse effects in any of the published studies. That's at least been my understanding with regards to dosing.
Well, that's exactly how I do it in my practice as well. We start out very, very small, and we can go up from there. But you're right. From the research, it's been all over the place, and it's one of those things that we're continuing to understand. And I think it also will show us more about the interconnectedness of the endocannabinoid system in our body and to other things as well.
Mm-hmm. Any idea about how much omega-3 are needed to take in conjunction with CBD and hemp oil to make it more effective?
Well, I think that when we're talking about two different things. I think from a lifestyle intervention, like I said, and helping to keep the endocannabinoid system in balance and healthy, the omega-3s and supporting our own endocannabinoids, wonderful. But then also the exogenous source of phytocannabinoids is something to use as well. So I think a healthy dose of DHA and EPA every day, 1,000 to 2,000 milligrams combined, would be a good recommendation based on, of course, individuality and what you're going through, with a small dose of the full spectrum of the phytocannabinoids. Once again, hard to say in general because everybody's so different and they are presenting with different complaints and different disease processes. But I think that the point there is that we've got these exogenous phytocannabinoids, and then we've got things in our lifestyle that we want to talk about all the time to do, that we continue to do, to continue to be healthy and to be at our optimum.
Mm. What happens when you take more CBDs than, well, let's just say cannabinoids, than are needed? Can the endocannabinoid system become out of balance? In the other direction, are there side effects from using too much hemp oil?
Sure. Now, what I've seen in my practice, and I think balance is a really key word here. We are trying to balance things, and that's why dosing is a great question, and it's something that needs to be discovered individually. But it is all about balance, and yes, and this helps me in my practice as far as dosing, because sure, you can get perhaps symptoms of fatigue in the morning if you have dosed too much on some of the phytocannabinoids, and that can happen. And once again, I think I just want to highlight that it truly is all about balance, and that's what we're trying to continue to figure out.
Another question is, one of the most frequent questions I'm asked regarding hemp oil is, how many milligrams should I take? Do you have a suggestion of how frequently a patient should increase their dose so that they get the most benefits?
Boy,
I've heard numbers between, for individuals, between 10 and 50 milligrams a day for most indications. Have you heard other
That's a pretty good range, and once again, so hard for me, especially because I see patients live every day, and everybody's so individualized, and you've got other things, you know, contributing to either the imbalance or also what's contributing to the balance that we're trying to do. But 10 to 50 is a pretty good, it's a pretty good range, and it's a great place for somebody to think about starting.
Are you aware, we did have some questions about asking for quality hemp oils on the market, and I appreciate everyone's interest in that. However, we try not to mention any branded names in these webinars because we want these to be purely educational. But thank you so much for your interest.
Yeah, and I think for the most part, when we're talking about that, just that one slide, there's things that, you know, you always want to look for. The supercritical CO2 extraction, I think, is important. The full spectrum of the phytonutrients. The fact that it's non-GMO, you know, I think there are some boxes that you can check that really make a difference when you're searching around.
All right. Contraindications with any conditions or medications. Are you aware of any contraindications?
Oh, gosh. I'm not really aware of any contraindications at this point. I'm using this successfully, especially I have a couple Parkinson's patients, and they're on all of their regular medications, and this just is enhancing their outcomes. And so I don't believe that there's any contraindications that I know of at this time.
All right. Here is a question. Let's see. Sorry, a couple of these are duplicates. Here's a good one. Can the use of hemp oil result in a failed drug test, since there are traces of THC?
Well, now, I don't want to send anybody down the wrong road.
Well, I'll tell you what I have heard and what I have read is that in working in both product development and in medical education is that you never say never to anything.
That's
However,
exactly right.
You never say never. However, most drug tests are screening tests, and they're looking for high levels, high enough to trip a trigger. So even though they always tell individuals if you've been exposed to marijuana in the last 30 to 45 days, it'll show up on your drug test. The truth of the matter is that it would have to be relatively consistent usage to show up in an amount that triggers a drug test. If you were to take maybe a 30-count bottle and take them all at one time, there might be the slightest chance. There's also, if it might be useful to talk to your healthcare practitioner about this, but for the most part, taking it according to more reasonable dosage levels would not be delivering the volume of THC needed to trigger a positive on a drug test. Yeah,
exactly. I agree with you. And when you're looking at a dosage of like a concentrated hemp oil at 10 to 50 milligrams, that amount on a daily basis with the negligible amount of THC is, in my opinion, would not, as you said, trip that trigger of a drug test. They're looking for, I think, higher doses and more consistent use. But once again, I think you and I are going to err on the side of safety here. You wouldn't want to sort of ruin anybody's chance at a job or anything else, and so I think to be continued.
Mm-hmm. Also, here's a question about what's the benefit of doing capsules? How about just a spoonful for culinary use? Well, I'm guessing, and I don't know this for sure, but if you're using hemp oil for culinary use, I'm thinking you're using the hemp seed oil because more
Correct.
people use that for culinary use. That has no cannabinoids in it
Yep.
at all, correct? So
Yeah.
that's why you would want to do capsules of hemp oil, because it's the one that has the plant cannabinoids, correct?
Right, and that it's been derived from the stalk, and that has the phytocannabinoids, and they've been extracted in a way that they can preserve those medicinal compounds, and that's what's going to give you the dose. I think this is another important thing. I mean, the gentleman that, or assuming it's a gentleman, and I'm not exactly sure why, maybe you said he, but that brought up the difference between hemp oil and hemp seed oil.
Mm-hmm.
We're just going to pull out the seeds there once again, because the hemp seed oil used culinarily, used in dietary supplements for essential fatty acid supplementation, omega-3s, et cetera, different than hemp oil when we're talking about what we're talking about with these phytocannabinoids that have medicinal effects on our body.
Mm-hmm. Here's a question about what's the best transport mechanism: vapor, candy, cream, etc. Do you have a take on that?
Sure. So, you know, I think that when we're talking about, when I love, you know, there's obviously different ways that you can consume phytocannabinoids. I think that the soft gel, like if it's just prepared and is definitely one way to go. But I think it's, you know, individual preference for the most part, and just understanding, though, what you are taking, what is in it, and how much it is. That's really important. And I think the way that you can, you know, get more clear on that is having a good quality supplement that you understand, and it's on the label, and you can also understand how it's been extracted and how it's been harvested, et cetera. When there are these other things, dosing is a little bit different. It's not so quantifiable, and so those things I think can be problematic. But there are different ways, certainly, to consume phytocannabinoids for sure.
All right. When you look at using hemp oil with the full spectrum of cannabinoids for pain relief and certain kinds of inflammation, is it actually helping to heal the tissue, or the issue rather, or is it just masking the pain?
You know, it's a great question, but both. I think that you're getting anti-inflammatory. So it is definitely, it's not just a symptom reliever. We are working on the body. We are working on the endocannabinoid system. I think that always identifying and treating the cause, so you're always looking to shut off the source of the flame or the source of the inflammation and not push sand against the tide. But this particular mechanism of action, not that I'm am an expert in this subject as far as the research, and as I said, that one slide that is extremely complicated in how the entire phytocannabinoid system does modulate the endocannabinoid system, but you are getting pain relief, but you're getting pain relief because of healing, and we've seen that, mostly I've seen that take place in the outcomes I've had with the more sort of central nervous system issues that I've seen. It's pretty amazing. People start to heal and have better outcomes.
Well, the questions still keep coming. Fascinating topic. Can you comment on the use of hemp oil with all the cannabinoids and/or CBD in conjunction with stem cell therapy?
Okay, question again, and I am so sorry. I know that we are at 1:35. So I can take about one more question here. Will you just repeat that question for me?
Do you have any experience with or views on using these compounds in conjunction with stem cell therapy?
Oh, sure. I mean, I think certainly two different approaches. And I wouldn't see anything contraindicated with stem cell therapy. Stem cell, another robust research environment for sure, very effective, but we're talking about two different mechanisms of action, so I think it would net positive based on what the goal of the application was. But as far as them being synergistic with each other, I think that we just have to look at case by case.